problem is when they did the study, they intentionally chose women who were no longer having symptoms of menopause, right? Because they didn't want, because it was double blinded, right? So they were going to give half the people estrogen and the other half they weren't going to give it. If you had hot flashes and suddenly they went away, then you would know that you got estrogen, right? So they said we don't want women who actively have vasomotor symptoms. That way they don't know if they got placebo or not. So these were women who were older, right? If you break down, so on average they were older. They were in their mid 60s, all right, on average. If you break it down into you broke it down to the women in their 50s versus the women in their 60s versus the women in their 70s. Yes, the women in their 70s who got hormone replacement therapy had worse cardiac outcomes, but they were 20 years past menopause already.
Yeah.
The women who were still in their 50s actually had less cardiac events, because if you continue with estrogen, then you still protect, and you don't build up the plaque, right?
Okay.
Once you've got the plaque, right? So it seems to be anti-inflammatory initially on the blood vessels. Once you form the atherosclerosis and then you give someone estrogen, then their risk of cardiac events is higher. So you don't want to start someone on estrogen who's 70. But if you're in your 40s, 50s, and you're having hot flashes, because there's data that women with worse vasomotor symptoms, the hot flashes and things like that, are ones at higher risk of developing cardiovascular disease. So if you are in that perimenopausal period, there's nothing better than estrogen to treat those. There's none of the over-the-counter things, none of the herbal supplements, nothing helps lack of estrogen than estrogen.
So